So, welcome, Daniel Adler. Daniel Adler hails from South Africa and now calls Toronto home. Daniel came to Canada in 1998 to study Chinese medicine. Adler works with a wide range of conditions, ranging from broad issues such as musculoskeletal pain and stress to more specific concerns around digestion and menstruation. He's particularly fascinated with the profound ability of how gentle, simple treatments have truly deep effects on health. And he is known for his ability to connect with clients and for his strong commitment to facilitate healing on multiple levels. As a teacher, he's known for his energetic, non-dogmatic, and enthusiastic approach to the transmission of information and his ability to work with students from a wide range of skill levels and backgrounds. Known as both Daniel and Taegyol, Taegyol is his Dharma name, which he received when he took Buddhist precepts in the Korean Zen tradition. It means harmonizing of opposites and conflict resolution. He uses both names interchangeably. Welcome, Daniel.
Thank you so much. Shall I just start sharing? Because there's part of the introduction,
yes,
acknowledgements.
I will pass it on to you.
Thank you so much. Okay, I'm going to do the share as you coached me to do it. Boom. Share. Oops, that's the last page. That looks good. Are we online? We're good, yeah. Okay, good evening, everybody. Thank you so much for taking time, your precious time this evening, to spend a little bit of time with me and with Shalin and Opus to discuss something that is quite special to me. I find it quite wonderful, which is the treatment of the abdomen. And I'm grateful for the opportunity to be able to talk with you a little bit about why this has become such a fundamental part of my clinical practice. And then the larger case I'm going to make, which is why I think that bodywork should be also part of a fundamental part of the modern clinical practice that we find ourselves in here, especially in the North American context. So we'll be talking about abdominal treatment, but the underlying message is more about bodywork integrated into acupuncture treatment. Before we go on, just an acknowledgement and a thank you. So to be very grateful, we are all grateful to Shalin and Opus Supplies for having us this evening and creating this space for sharing. They've been doing an amazing job to promote our practice, our profession, our art. And so I was very flattered to be asked to be here with you. So I'm grateful, but I would also like to say that we are grateful, all of us, to all of our teachers, our colleagues, our patients, our family, and our friends who have supported us and have made our practices possible. We don't do this alone, and so I think it's important that we acknowledge that we are a small part of a much bigger system, and we're lucky to be here. So thank you to you for being here, to Shalin for having us, and to all other beings. Okay, who am I? I don't want to spend too long about this because it's not really why you're here. You're here to hear about the abdomen, but a quick little spiel about myself. The first kind of profound statement is that I am a strong believer in the requirement of bodywork as a non-optional integrated part of the acupuncture treatment. This comes from the fact that I started my training back in 1998. I actually started out in acupuncture. I came from South Africa to Toronto to study, and I ended up staying. And started out in acupuncture and Chinese medicine, but found my way into the practice of shiatsu. Shiatsu is the Japanese, one of the Japanese bodywork arts. Shiatsu, finger pressure. And I found myself in a very immersive and experiential training of that practice. And I ended up training in that way for 10 years with a specific teacher. And so that has very much formed my approach to the healing arts and to our practice and to our profession. And so while I am an acupuncturist and I'm also a herbalist, the bedrock of my practice is bodywork. And I believe very much in bodywork as a corrective tool for musculoskeletal problems, of course, but also ranging from very physical problems up to the psycho-emotional and even spiritual problems, because good connected touch is so critical in our practice and in the world today. So I'm a strong proponent of that. A bit more about me. I am also a husband. I got very lucky when I came to Canada and I met somebody who was willing to spend her life with me. So I'm a husband, I'm a father to 3 children, I'm a son, I'm a brother, I'm a nephew, I'm a friend. So that's some of the roles that I play. And I've been in practice for 26 years. I started very young, and I feel very fortunate to have been able to find this practice so young, so that I feel like I'm not even halfway through my life, and God willing, and I already have a lot of experience, and I feel I can finally start to talk about that because I've practiced for so long. It's not a quick thing for me. Like I said, I came to Canada from South Africa. I'm born in Johannesburg, and I grew up in a very troubled country. And it's quite a relief to live in a country like Canada, which, while we have our troubles here, they're different. And I came to study acupuncture and Chinese medicine and shiatsu and herbs. I specifically practice the Japanese herbal system called Kampo. Um, and I'll talk a bit about that because it influences the abdominal work. I'm also a teacher, as was mentioned. I've been very fortunate to be on the faculty at the AIM Academy since 2012, teaching in the acupuncture and their shiatsu program. Sadly, their shiatsu program is no longer running, but I occasionally now still teach. I taught quite intensively in their programs there for a number of years, and then now go in to assist in the student clinic, as well as teaching some postgraduate courses there. In terms of clinical work, I've worked in many, many clinical settings. I've worked in private clinics. I've always been a sole practitioner. I've worked in multidisciplinary clinics. I've done much work in people's homes. COVID really amped up the house call part of my practice. I've done a lot of work in hospitals, and as well as in hospices. And so I've seen a lot of very gritty sort of casework and patients that way. Recently, I was asked to fill out a form for our association. Maybe some of you are a member of the TCMO. If you're not, I strongly encourage you to join them because they're certainly doing work to represent our profession. But they asked us to fill out a form. And one of the questions was, what conditions do you like to treat? And I kind of sat looking at that question for a few minutes and scratched my head, because really what I really love to treat is the human condition. And I know some people roll their eyes when you get an answer like that, but I'm particularly fascinated in facilitating people during significant life transitions and providing a space for them to find health and healing from their symptoms that are perhaps plaguing them, but also to get them through difficult periods and difficult transitions. All of that is to say that this accumulated work of 26 years has led me to thinking a lot about working with the abdomen. And so now let's dive into that a little bit. This is the idea. So I think we all know that from our very first acupuncture or Chinese medicine classes, we're told how important the abdomen is, the dantian, with the point qi high, and then we talk about this kind of core and the girdle, and in the Japanese tradition they talk about the hara. So we all are very much imbued with this idea that this is a very important part of the body. We talk about it a lot. We're shown how to needle it. Many of us put moxa on it, and some of us do our own internal cultivation practices, breathing, and qigong practices to cultivate the vitality in this area. So we're all very much indoctrinated into that this is a vital area to be cultivated. And I thought about this as I was working and starting to teach, and how we spoke about it a lot, but we weren't taught a lot of actual techniques to work directly and deeply with this very important foundational part of our health and vitality. And that was always a bit of a disconnect to me. Why would we make such a big deal of this area? We all know it's important. But why would we limit our treatment to just putting some needles and maybe some moxa? Why would we not delve deeper? And that's not to say that there aren't professions or practices out there who do that. Of course there are. Qinetsang is a very famous one. I think there's Hawaiian abdominal massage is another one. There are lots of systems out there. What I'm talking about here with you tonight is nothing new, and it's certainly not unique to me. I haven't created anything special, but I do think it's special. But I thought about, well, why are we not directly treating this area more? As acupuncturists, as practitioners of Chinese medicine, why are we not using all of our tools, one of them being these hands, to really activate this area? So I took that philosophical or traditional idea, which we all hold dear, that the abdomen, the dantian, is this crucial area. And I decided to really start to work with it in a very visceral, practical way, in a physical way. My basic thinking is, if it is that important, then we should work with it more and more and more and more. Why not literally use our skills to work with that foundational area? Because the theory says that if the qi is flowing, the blood is flowing, and the functionality is flowing in that area, then the person should be healthy. I mean, that's why we do all these cultivation practices. So I thought to try and really engage that in my practice and in my clinical work. So that's where the idea kind of evolved, that first kind of itch in my brain. But as I said, this is not a new thing, and I certainly have not invented it. I just have been practicing system, which has I've then refined and onboarded new information and updated through the years that I've been using it. So I want to emphasize that what I'm practicing in clinic right now, although its roots are in shiatsu, but it is no longer just shiatsu. It's not even tuina. It's not ampuku, which is another Japanese style of bodywork. It really is a combination of all of these, and should be considered as I've written here, team, traditional East Asian medicine, abdominal treatment, diagnosis, protocol. I want to emphasize that right now. Treatment, diagnosis, in the same way that it's almost incorrect to say yin and yang. It's yin yang. It's treatment, diagnosis. It's not treatment and diagnosis. They are happening simultaneously. Of course, we start with one and then we do the other, but they are happening together. So it's a practice of treatment diagnosis that I've been working with for 26 years. I've been very lucky to have some kind of guiding points along the way. I've met certain practitioners and teachers who have really helped me with this. And the first was my foundational shiatsu training, where shiatsu is a wonderful system because it's it's a very Japanese way of teaching. You teach kata, you teach forms, and there is a form of techniques for treating the abdomen. And this was taught to me back in 1999, I believe. And I've been working with that and developing that skill ever since. So that forms the basis, the kind of first block in this scaffolded treatment. Then along the way, after having worked with this for a few years, I did an internship with a wonderful doctor here in Toronto. Her name is Susan Hu. She runs the Best of Chinese Medicine clinic out on the Danforth. And she was very kind to me and let me intern with her. And she once, almost as a throwaway comment, mentioned to me how she would consider the abdomen and divide it into quadrants through the navel. So from the xiphoid to the pubic bone through the navel, and from one side to the other side through the navel. And each quadrant represented a further part of the body. Now, I'm sure already, as I say that to you, that some of you out there already think, yes, of course, that makes perfect sense. And of course, it makes sense because our meridian system, our channel system speaks to that. But the fact that Susan showed me this and just she divided the abdomen and she said, oh, the person has this pain here. And she felt around in the abdomen and she found the person had long-term pain in the right side of their neck. And it wasn't going away. She'd feel around in the upper right quadrant of the abdomen and she'd find a point and she'd put a needle in there and she'd leave it there. And it would somehow affect the workings of the neck. And as I say, this happened quite early on in my career, so I thought this was quite magical at that time. But having worked with it over years, I'm no longer convinced of the magic or mysteriousness in terms of why that works. The magic is that we get to do the work and get to work with people. That's the mystery. But there are good reasons why what we do works. So there was my Zen Shiatsu fundamental treatment protocol, then adding on this idea of dividing the abdomen into the hara, into quadrants. Then I was very lucky to meet a man called Nigel Dawes, who practices Kampo. He was also a shiatsu practitioner and an acupuncturist in the Japanese tradition. He practices in New York. And the Kampo herbal system is fascinating because where the Chinese medicine herbal system abandoned abdominal diagnosis over the course of its development, the Kampo system retained it and actually evolved it. And it's now a cornerstone of that herbal prescription system. And there are direct abdominal findings that one finds in the abdomen that point directly to formula families. And it's fascinating. And again, one could be kind of cynical about that until one considers that in Japan, the only people who are allowed to practice Kampo and prescribe this way using the abdomen are doctors and pharmacists. So highly scientific people are using the abdomen to prescribe classical herbal formulas. So I found that fascinating. And over the years, I've been using this system of diagnosis, what they call fukushin, specifically for prescribing herbal formulas. But there are broader constitutional findings that we feel in the abdomen, which have now circled back and have influenced how I work with the abdomen in a bodywork and acupuncture manner. So this is the third influence on the evolution of this system that I'm now using in my treatment and in my clinic. Ampuku, I actually don't know much about Ampuku, except that I had a very intensive weekend training, not a training, I went to a shiatsu summit last April. And two of the speakers there were these two women from Italy, Manuela Peradi and Serena Trotti. And they've been doing a lot of work with classical Ampuku text or texts from Japan, translating it, understanding the techniques that are prescribed in it and how to use it. And they demonstrated at this workshop, and they really showed me how you can start with the abdomen, you can then expand the work out through the body, along the limbs, along the back, along the head, feet, and then come back into the abdomen. So they, in a sense, showed me how to take the little abdominal protocol that I had, the original one, and expand that out using techniques as well as of Ampuku and Shiatsu, and then bring it back into the abdomen. So they were focusing very much on the abdomen, but expanding it out and bringing it back in. And I thought, oh, well, I'm experienced. I'm a good body worker. I can do that too. So I'm not an Ampuku practitioner. I need to be very clear about that. I've not studied that system. But how they were working inspired me to then adapt my shiatsu practice and my acupuncture practice. So those are the first few influences, but there are a few more. Now, the kind of fundamental influence and I need to give credit to this person, although I've never met him. He died, I think, in the 70s. Is Masunaga Shizuto, sorry, who was one of the premier Japanese shiatsu practitioners, who did a great deal to spread shiatsu throughout the world. He was one of a number of practitioners, but he very much codified this statement, which I think many of us know. I don't think it was unique to him, but he was very much a proponent of this, which is that treatment is diagnosis and diagnosis is treatment. They are the same thing. They happen simultaneously. This, I think, is very important for when we're working with the abdomen, because I will get my initial feeling of the abdomen. I'll talk through the method of how it works in a short while. But I will get a feeling for the abdomen, the kind of overall sense of it, and then I will do the diagnosis, which this gentleman Masunaga came up with. Now, I've put his chart up behind me, and some of you might recognize this. I'm sorry about the glare and everything. It's more for you to just get the feeling. But this is the one I want you to kind of, if you can see it a little bit. He took what he called the reflex zones of the different organ systems and expanded them through the channels. He did a lot to expand the meridian system, and I'll talk about that in the next point. The idea being that, and this is very familiar, I think, to people who study. There are many classical abdominal pictures out there, and I'm sure if you took time to look at this one and then looked at some of the older ones from some of our Chinese medicine texts, there'd be a lot of overlap there. This just happens to be the system that I'm trained in, so I've leaned into that. But what he did was, beyond just the techniques of treating the abdomen, he codified this system of reflex areas relating to the different organs, and then those spread out through the meridian system. So by palpating and feeling different areas and different findings in these key areas along the abdomen, you then are told, or you get a sense of which channels you need to be working with through the body. So this diagnosis leads to the treatment, but it can also be used as the treatment, because you can also treat directly the organs by working with these reflex points. So by working on these reflex points, you're actually affecting the organs that they relate to. So the diagnosis map is also one of the treatment maps. So Masunaga was very emphatic about that. The other thing that that I owe a gratitude to Mr. Masunaga was this extended meridian system. Now, this particular chart is quite complex, but if one takes time to study it with a Chinese medicine channel eye and thinking about our channels and our collaterals, one can start to see that what he's done in some way can also relate to our understanding of the six-channel theory. What I've written up here on the slide, I want to just be clear that this is not the Shanghanlun levels of disease of the pathogen invading the body. That's not what we're talking about here. We're talking about the channels as relating to their anatomical position on the body and how they link up as one channel. So as opposed to having 12 master meridians or master channels, primary channels, we can actually talk about 6. We can talk about the Taiyang channel, which would be the combination of the urinary bladder channel on the back, on that and posterior back position, and the small intestine channel in its posterior yang aspect, and how they can link up and they get very close to each other in this region here. So that then becomes one channel. And that bears out, I think, in our modern Chinese medicine practice as well. The Shaoyang channels, gallbladder, triple energizer, Yang Ming, stomach, large intestine, Tai Yin, spleen, lung, and so on, Jui Yin, liver, pericardium, and shaoyan, kidney, and heart. So I no longer really think as much in terms of spleen channel and lung channel. I think more about high-yin channel as for example, a channel that will run from here. As we know, it comes to here, and then it will link to the spleen channel, which we know starts here, comes through, and we know what it does, and they meet here. So if you can see that, that actually in effect becomes one long channel. And that can be applied obviously on both sides of the body, but to all of the channels to make 6 larger channels of systemic regulation. And that has been how I've been thinking about the channels for quite a long time now, and how I'm needling them in terms of using this system. So that's the theoretical foundation for this practice that has evolved. So the pivot point, the point that made me think, well, I had to find a way to stay true to my bodywork beliefs, as well as to use my acupuncture in a way that was treating systemically as opposed to reacting, say, to just shoulder pain or something like that. And so I started to think, how can I do this? And the answer came to me when I realized I've been diagnosing using this map all along, looking for a most deficient channel system and the most excessive channel system. And if I was just doing body work, well, then in a shiatsu treatment, I would go on, and if in the most excessive system, I would disperse that channel. And in the most deficient, I would tonify that channel using my hands. But then I realized, well, why wouldn't I just do that with the needles? And then I could spend more time working on the abdomen, this fundamental, foundational, crucial area, which is supposed to be the center of all vitality in the body. So why would I not spend more time on the abdomen and let the needles regulate the most excessive channel, the most deficient channel, bring those into harmony while I work here in the center? So once I've kind of decided that that was the way to go, it's pretty easy after that. And frankly, anybody can do it. Like I said, this is nothing new. It just came to me. In terms of which needles I choose, which points I choose to needle, once I have established after my diagnosis, which is the most excessive system in the body and which is the most deficient, I will then choose. I usually use the R.Ac points or the UN source points, but any of the 5 shoe points can work. And frankly, I know that there are a lot of people doing like channel palpation work now. It's really great. I think I forget his name. He teaches Jonathan Chang, maybe. He does a lot of this kind of palpating the channels to find, and you can put the needles on those specific areas. Why not? It's one long channel. It's like a pipe with blockages. Put your needles and unblock the pipe. Put your other needles and fill up the pipe. So unblock the excessive channel and fill up the deficient channel. I just happen to enjoy using the R.C points and the UN source points the most. So what would happen is, let's say I did my diagnosis and I found that the heart channel was the most excessive and the spleen channel was the most deficient. I would then likely needle heart R.C point, and possibly the heart UN source point. And then on the other side, on the opposite leg, I would needle the spleen R.C point and the spleen UN source point. So to match it up, so I would do like here and here, and then I would do on the opposite side here, here and there, for example. One to boost up the channel and one to disperse the channel, while I get to continue to do touch, palpation, physical connected work here in the abdomen with my hands. So that's the basic system. It's quite simple. The method is very simple. First, you make a touch, you connect with the patient. We have to remember this is a very vulnerable area. I think it's a privilege to work with a person's abdomen. I learned something because we got a cat in COVID. We got a cat, and I learned that cats will give you their belly when they trust you. Oh, that makes sense. Very vulnerable, soft area. So it's a privilege to be able to put your hands on a person's abdomen. So that first touch is so important to establish the connection. Take a moment to do that. Then I start to the initial palpation, opening technique, start to soften the abdomen, start to get a sense of the lay of the land and the condition of the tissues underneath it. I'm not diagnosing it. I'm just getting a feeling, making connection, establishing a rapport with the abdomen, what it's telling me in my hands. This is before I'm even thinking of any needles. From there, once things have started to move a little bit, I'll start to do this diagnostic kata, this form where you put your hands in a very connected way, getting the feedback from, as you put the pressure on, what the body responds. In the same way that we put the needle in and get the dirt chi, the arrival of the chi, well, the body does the same to your hands, to your fingers. You just have to be sensitive to it. So rather than driving my hands into the into the abdomen, I'm going in slowly, sensitively, listening to get the feedback from what the tissues are telling me. So this is the diagnosis and treatment, because while I'm doing that diagnosis to establish the main excess, the main deficiency, it's starting to influence the organs and meridian system. So diagnosis is treatment at the same time. Once that's happened, I've selected which is the most excessive channel, which is the most deficient channel. I'll put my needles in for a moment, and then I'll come back and I will do extensive work on the abdomen using palms, fingers, thumbs. I use my knuckles. Occasionally, I'll use the side of my hand or even my fist. I'm a little less gung-ho about that, although I do use it sometimes. And various techniques to really work with the abdomen and find areas of excess and deficiency and start to work with dispersing them as well as building them up. Then you remove the needles and you consolidate the work. You kind of pack everything back together in a very nice, nourishing and loving way. So that's the method. It's very simple. And I'm pretty sure that there are other people out there doing very similar things. Like I say, there's nothing new under the sun. I've just been working with this and it happens to resonate with how I like to work with people. The last note here, it says excess, deficiency, and stagnation. It's all just tissues. I really like that. I like that I'm no longer thinking of the abdomen as separate compartments. Yes, of course, the organs are in there and various cavities and everything. But for me, it's just one unit of excess, stagnation, and deficiency. And that's told to me through what the tissues say when I touch them. If I need to disperse more, if it's really hard, then I have to figure out how to disperse it more vigorously. But if it's very soft and lax, I need to find ways to literally bring more blood and more, as a result, more chi to that area to build it up, to boost it. So the practice is about being very connected with the abdomen while the needles are doing their work peripherally, being very connected with the abdomen and responding to what the tissues are actually telling you, which I find lovely. It's like a conversation. It's not a theoretical concept, oh, the person's liver chi is stagnant, so I need to disperse the liver. No, it's what do I feel in that area and how do I respond to that, as opposed to imposing a concept onto the abdomen. I'm very engaged with it while the needles are still doing their acupuncture work, peripherally regulating the system. So cases, what is it good for? Ultimately, I think this is a treatment protocol more for systemic regulation. I have patients now who come for this treatment as a standalone treatment, in the same way that you might have patients who come to see you for cosmetic acupuncture, or for whatever specific protocol you might have. I have patients now coming for this treatment, which is wonderful. But I've also found that in using this work and practicing it more and more, getting more skilled with it, that I'm able to start to treat a lot of lingering chronic problems because the evidence for them shows up in the abdomen, which makes sense because if the problem is up here, let's say on the small intestine channel, well, there's a correspondence for it down here. I'm likely to find some kind of obstruction here, and maybe according to the four quadrant theory, maybe something up here. So if the pain is up here, I'm going to be looking for something a little bit extra stagnant in there, and maybe something around here in this small intestine diagnostic reflex. So I'll have a needle in the small intestine channel, and I'll have a needle in the corresponding deficiency channel. And then I'll be working with the whole abdomen, but I will be very vigilant to try and find an area that corresponds directly into that quadrant, as well as something that might be a bit more gritty in that particular diagnostic area, for example. So I've had a lot of success treating back pain, more chronic back pain, with this system. And we could explain this through a pure anatomical, a skilled anatomist would be able to explain this through anatomy, like by working the front, we work the back. We understand these things. I'm just happen to be using it through a Chinese medicine, Eastern medicine paradigm. Treated a lot of people with headaches. This has helped a lot of people with headaches and migraines. Is interesting. Seem to do quite well with this sort of a treatment. Insomnia. I've worked a lot with digestion and people who've had absorption issues, and that makes sense because we're working fundamentally with those organs. Now we're actually massaging those organs and helping them get their vitality up. So that makes a lot of sense. And of course, menstrual complaints, and I work a lot with that because again, then in that case, we're working directly with those organs, those structures in the abdomen, as well as things like anxiety, other emotional, mental emotional concerns seem to respond quite well to having foundational and focus work on the abdomen. So I wouldn't say it's a miracle cure. It's not a cure-all for everything. Sometimes if the person's got neck pain, you've got to work with the neck. But if the person does have neck pain and they come in and I work with their abdomen for a little bit and do the systemic regulation first and then go to the neck, I often find that the results are longer lasting and more impressive, for example. If a person comes in with their headache and I will put some needles for the head or on the feet or whatever, plus this choice of the excessive channel, the deficiency channel, spend some time working on the abdomen, and then work with the head. Again, the results seem to be more profound because you're doing a deeper systemic regulation. The areas which I find haven't responded very well are very acute cases. Those the abdomen is sometimes just too hard. It's interesting. The body's in such a state of reactivity that it's almost uncomfortable to work with the abdomen at that point. So I haven't had a lot of success there. But again, maybe there are people out there who have. My joy in working with the system is working with more chronic, long-term cases, supporting people by working with this very fundamental area of their bodies, this vulnerable, fundamental to vitality area of the body. So those are some of the cases that I've worked with. Then there's the future. I'm always thinking ahead. And I kind of, as I was writing this today, I was talking with a colleague of mine, and she was like, "Oh, that's so cool! You're doing this." She said, "You know, they're talking all about the brain-gut connection right now, and the second brain." And I thought, "Oh yeah, well, absolutely." You know, I love that what we do, this ancient medicine, is now unfolding with a modern understanding. I think that there's only further that we can go with that. It's not, there's no contradiction here, there's no conflict here. The modern understandings only make our practices better. I would love to be able to sit with an osteopath, for example, and discuss this, because they would bring a whole lot of understanding, which I've got in my hands through my practice and through the meridian channel regulation. But they would then go, oh yeah, these enzymes, this and this particular sphincter, that, and somebody who really knows anatomy would have a field day taking this even further. So I'm quite excited about where this could possibly go, by people who would start to work with the abdomen more intensively. So I obviously have a hope that this little conversation tonight will inspire perhaps some of you to even just cautiously start to work with the abdomen a bit more. And so this is kind of my final thought and my overall case, if you want, for this conversation that we're having. I think that our practices here in the modern North American context, where we are practicing at the moment, require us to do more body work as acupuncturists. I'd go so far further to say, in the world that we're living in right now, the more touch and connected touch that we give our patients, the better. The manifestations of that and the ramifications of that, I think, are infinite. I think the model of you put the needles in and you leave the patient, that's never worked for me. I think we are there to be present with the patient, and while we're doing that, why not touch them and give them some touch? Because some people never get touched, but touch, good touch, not smashing touch, good touch, and then strong, skilled body work, manipulations of joints, working with the channels, with the tissues and things like that, is so valuable and so precious. So even if after today you take just your patient tomorrow has come with, say they've come for a facial rejuvenation treatment or cosmetic acupuncture, and you're going to put all the little needles in there, but why not spend a little bit more extra time massaging their hands or their feet, or be extra bold and just start working with their abdomen, obviously, if they give you consent. It stands to reason that if they're wanting to brighten up their face, and our medicine says the face is a reflection of the state of the internal, so the channels are the carriers of the blood and the chi and the vitality to the face, then by working with the abdomen, you'll give extra value to the treatment. You'll turbocharge your treatment. Your cosmetic acupuncture person will be extra radiant because their internal organs are now functioning better. So I'd encourage you, if patients come for sprained ankle, they've rolled their ankle, and obviously you're going to massage it and you're going to put your needles and you're going to massage it more. But what are you going to do in the 15-20 minutes that the needles are in the ankle? Why not work with their abdomen or their corresponding wrist or something, or the other ankle? I mean, give body work. I think that's really a big value add. The patients here, we're not in a hospital system, so they pay us out of pocket. They're paying us not just for our technical skill with needles. I think they're paying us for our presence and our time too. And part of that is us being with them and using our skills of touch, palpation, body work, and manipulation, in good manipulation in a good way, to help. So that's my final. That's the case I'm making tonight in this sharing conversation that we're having. So that's basically me. Thank you again for listening to me. And this is my thing. I say, stay golden. So I hope you all stay golden. I hope you help many people. I hope that maybe we can meet in person sometime. I'm always available for that. But otherwise, just thank you for your time tonight, because I know time is precious and you've given up some of that to be here tonight. So thank you. Over to you.
I will just get you to stop sharing,
I
and
can
I
try.
can.
Try to figure that out. Yeah, I'm done. Good.
Great. Thank you so much, Daniel. It's interesting that you were talking about pairing it with other treatments like cosmetic acupuncture. Somebody had actually asked about that. Can you do this with cosmetic acupuncture? So I think it's on top of people's minds.
Absolutely. Is that an actual question?
Yeah.
So, 100%. So I have patients who come for facial treatment, cosmetic acupuncture, or just facial rejuvenation. And in my case, they get a lot of work here and here first. The needles go in. I'll then go to the abdomen, find my excess channel, my deficiency channel, needle there, and then I'm working with the abdomen for the rest of the treatment while the patient lies there. I think
So
it's
how long do you take for the abdomen acupuncture treatment per session?
usually about half an hour of the whole treatment, because there are other things that people come for. Um, I'm getting more patients who are coming specifically for this, in which case what I will do then, because more than about 40 minutes of work on the abdomen is really intense.
Yes.
Um, so what I will do for those people is I work on their back first. I open up their back first,
Ah,
then turn them over, do the diagnosis, start the work, put the needles in, and then continue. So that's about, but so maximum would be about 40 minutes. But if the patient has come for, say, a facial treatment or some other concern, neck or wrist or whatever it might be, then it'll be less, probably about half an hour on the abdomen, and then enough time to allocate to the chief complaint, the presenting symptom.
yeah, that was another one question is if you combined it with back shoe points.
So sure, that would take more time in terms of needling. So I would work with the back shoe points using my hands and my elbows. That's just because I am a proponent of physical body work.
Yes.
But you absolutely could do that. Why would you not? Again, if you've done some kind of diagnosis to establish a most excessive system and a most deficient system, and you wanted to then needle, you'd have to do 2 rounds of needling. You'd turn them face down first, and you'd needle the back shoe points. And again, while they're down there, why not? And you've needled the back shoe points, work their legs, work their head, whatever, and then turn them over, needle your excessive channel and your deficiency channel, and work with the abdomen. So that's for you to experiment with for sure. But absolutely, that would work. That'd be a great treatment.
So someone had the question about placing the hand on an abdomen, what you feel to differentiate between excess or stagnation.
Hard.
So they had mentioned they would expect deficiency would be soft and yielding, but could that also not be considered normal? Is it temperature as well? Do you find temperature differences with the abdomen?
Mm-hmm. Um, you know, as a concept, excess stagnation deficiency is very helpful. So excess stagnation deficiency. Um, and yes, clearly the deficiency, you can feel it. It's lax, it's cooler, it can be clammy, all these kind of things. Excess is really hard and it pushes back on you. It's like a pneumatic tire or like a bouncy ball, boing, boing. But most of the time, truthfully, it's what we would call stagnation, which is this kind of gray area in between those two poles. Everything ultimately is stagnation with some true deficiency, and then occasionally you find a real bouncy, exuberant excess. Um, how I feel that initial touch, what Nigel Dawes calls the round robin, the initial opening connection, you're feeling for the condition, the overall condition of the tonus of the abdominal flesh, the skin, you're feeling for temperature, you're feeling for laxity or hardness or fullness or laxity, um, coolness. heat. Um, it's almost like pizza dough. If you've ever made pizza dough, and sometimes you make it
Oh,
too wet, and that's very lax, that's very deficient. Versus if you haven't put enough water and it's very hard. Those are kind, and then you have to kind of manipulate it and soften it until it becomes nice and smooth. So that's a way to think about it, perhaps. But you're feeling those conditions through your hands. And then in terms of getting to the specific channels that you want, the most excessive or deficient, I use this map. I love this map. I've it's become very dear to me. But you could do it by doing the pulse. If your pulse diagnosis is great, and you just feel the positions on the pulse, you would find which is the most excessive, which is the most deficient, and that could be the way you get there. You could do it through your questioning if you spend time um, questioning, and through your questions you've discovered that the person has liver qi stagnation and kidney yang deficiency. Well, then your liver is your excess and your kidneys your deficient. So you're going to needle the liver, you're going to needle the kidney channel, and then you'll do your work on the abdomen. So there are many ways to get that. I just happen to really like this connected way through the abdomen.
I think we're all going to go practice with some pizza dough.
Yeah, please do. When I was initially trained, one of the good methods that my teacher introduced us to was he would get a big vat, a big bowl, and we'd get one of those big bags of rice, the really big ones, or two of them, and fill the bowl with it. And I spent hours just playing with rice in a bowl, to get that feeling and to develop the dexterity and the sensitivity in the hands. And then pizza dough is the next thing. But it's a good way to think of it. Yeah.
That's great. A full meal.